What's up, guys? This is Brenda of Zackel & Associates. Thanks for tuning in to another Surgical Sunday. I want to talk briefly today about the use of tourniquets in surgery. Tourniquets are commonly used for upper and lower limb surgeries to optimize operating conditions. These devices are often used by orthopedic and plastic surgeons, anesthesia care providers, and podiatrists. They reduce bleeding, expedite surgical procedures, and give the surgeons improved visualization of the surgical site. When a limb is exsanguinated, meaning drained of blood, a decrease in oxygen and cooling of the limb occurs. Complications can arise, including nerve injuries, pressure injuries, chemical burns, tissue necrosis, and compartment syndrome. A more serious and fatal injury that can occur is deep vein thrombosis. This is when a blood clot forms inside deep veins in your legs or pelvis. The clot blocks blood flow and causes pressure to build up in the vein. Part of the clot can break away and move through your bloodstream to your lungs. When this happens, it's called a pulmonary embolism. Imagine this real-life scenario. A 30-year-old man sustained right leg fracture from a motor vehicle accident but had no other significant injuries. The orthopedic surgeon delayed surgery to fix the fracture due to the presence of limb edema. On the 6th day after the injury, the patient was taken to the OR. Before the start of the procedure, the surgeon exsanguinated the limb using an S-mark bandage. The surgeon then inflated the tourniquet to 300. The patient's blood pressure dropped suddenly within 3 minutes of tourniquet inflation, and the patient lost consciousness. The procedure was suspended, and the patient was transferred to the ICU. After an evaluation, the medical team determined the patient had experienced a pulmonary embolism, and that the application of the S-mark bandage and tourniquet inflation could have caused the detachment of the blood clot. Although cerebral protective measures were taken, the patient did not recover neurologically and died on the 9th day after surgery. The patient had risk factors for PE, including fractures and immobility. The stress of exsanguination and tourniquet inflation could have dislodged the emboli. It is important to assess the patient preoperatively for contraindications to tourniquet use and factors that may increase the patient's risk of developing complications. Use caution for patients who are older adults, have low pre-op hemoglobin, increased risk for venous thromboembolism, or have a high body mass index. Specific contraindications to pneumatic tourniquet use include peripheral vascular disease, previous arterial bypass grafts, and thigh circumference larger than 100 centimeters. Has your client been injured by tourniquet use either in the hospital, by ambulance staff, or otherwise? If so, it is in your best interest to get quality advice from a certified perioperative legal nurse to get the answers you need to develop your case. Thank you guys for watching, and don't forget to subscribe to not miss any future videos. This is Brenda Zackel, bridging the connection between medicine and law.